So the fourth case scenario is that of a 40-year-old male who presented with redness, pain, discharge, decreased vision in the right eye since 10 days. The patient had no history of trauma or foreign body lodged in the eye. There was a decreased corneal sensation and the patient reported excessive light sensitivity. So if you see here, there is excessive circumcorneal congestion. A little bit of staining here can be seen in this area. The anterior chamber depth seems okay, but corneal sensation is something that you need to check, and we'll be coming to that later, how to check corneal sensations. When this patient is stained with fluorescein dye and looked at with a cobalt blue filter, you will see these small multiple corneal dendrites which are suggestive of viral keratitis. Now, so how do we check the corneal sensations? You need to wash your hands, make a point out of wisp of cotton, explain the test to the patient. At this point, the fans should be turned off so that there is no reflex watering. You use a sterile fine cotton wisp. Explain the test to the patient, approach from the side as we did in this case, touch the edge of the cornea gently and first touch the unaffected eye before you go to the affected eye. And then the patient can grade the sensitivity on a scale of 1 to 10. It's an arbitrary scale. And sometimes some of your elderly patients will not be able to scale, but there's nothing to worry. Since you are watching the patient, you can make your own arbitrary prediction regarding the sensitivity. And if you don't have a cotton wisp and an esthesiometer, you can use a dental floss for checking the corneal sensations.